Hi, I'm Dave Fornell, editor of Diagnostic and Interventional Cardiology and associate editor of Imaging Technology News. I'm here at the 2011 Radiological Society of North America Conference in Chicago, and I'm here to show you some of the latest technologies that are being offered in imaging by vendors here on the floor. I'm here on the floor of RSNA 2011. I'm in the Siemens booth, and I wanted to show a new technology that may be useful either in the hybrid OR, the OR, or in the cath lab. One of the issues that physicians run into is trying to take images, 3D data sets, and being able to rotate them. Usually they have to refer to a technician and describe to the technician how they want it rotated. This is a hands-free technology that is a work in progress that Siemens is gathering feedback for their single via system for possible integration in the future into their software technology. I'd like to demonstrate that for you very quickly. So you have your cath lab screen in front of you or from your hybrid OR. With a hand movement up, you can choose your image, and you could actually lock onto the image and rotate your anatomy back and forth to get the orientation that you want to see specifically for the vessels. We're in the Toshiba booth at RSNA 2011, and they have an introduction for the Apleo 500. This is their newest ultrasound system that they're introducing here at RSNA, and it has a couple interesting features that are new to ultrasound. They have a fly-through feature where they could actually take any fluid-filled space, such as a blood vessel or a uterus, bile ducts, hepatic vein, as is seen here. And they could actually do a fly-through and be able to visualize the structure from inside instead of outside as you usually see it from ultrasound. What's interesting about this technology is it actually offers almost a CT-like view, similar to what you would see it with colonoscopy or a virtual colonoscopy. We're here in the GE Healthcare booth at RSNA 2011, and GE introduced just a couple days ago a brand new angiography system, which is quite different than any of the fixed ceiling or floor mount systems that have traditionally been offered over the last 20 or so years. This is the Discovery IGS 730. This system is not yet FDA approved. It's FDA 510K pending. However, it offers a new way of looking at an angiography system in both a hybrid lab where space comes at a premium or in a cath lab where space is also at a premium. The system, instead of being on a gantry on the floor ceiling, actually is on wheels. It can move anywhere you want within the cath lab, even in the corner if you were doing an open procedure in a hybrid OR. And it offers all of the advanced imaging capabilities of a fixed system, but has the mobility of a mobile C-arm that you would usually find in a vascular lab. The system is laser guided. It has a spinning wheel up at the top that shoots out a laser. It has detectors around the room so it can get the precise location of the system no matter where it's at in the room. So it has precise alignment with rotational angiography features or any other advanced visualization hybrid imaging. We're at the Tier Recon booth at RSNA 2011, where they have two interesting pieces of advanced visualization software for cardiac analysis. One of them we'll take a look at strain motion within the myocardium, very similar to what you would see on an echo wall motion. The second piece of software Tier Recon is showing is not FDA cleared yet, but it is kind of exciting because it is CT myocardial perfusion imaging, where they could take a CT data set and they could actually color code it very similar to a PET or a SPECT image to actually show ischemia on the myocardium on the beating heart of a CT cardiac cycle. We're at the Vital Images booth at RSNA 2011, where the company just had FDA approval last week for a new software package called CT Myocardial Analysis. And this software takes a look at the contrast wash within the myocardium and could be presented both on a bullseye and also a wrap on the left ventricle itself. We're at the QI imaging booth here at RSNA 2011, and one of the trends that we're seeing with advanced visualization companies is the use of TAVI planning modules for transaortic valve implantation. And that'll become more popular over the next couple of years. The planning requires CT data sets to see if the patients even qualify for the procedure, to plan routes, and also for proper sizing of the device, and for guidance actually during the procedure. What you see here at the QI imaging booth is a deformable registration of a heart in a cardiac cycle, showing the aortic annulus and where the valve would actually be seated. The deformable registration actually helps with showing cardiologists how that valve would react with an actual beating heart as opposed to a flat 2D non-moving image. We're here at the Philips 2011 RSNA booth where they're showing the Allure Expert FD20 angiography system with the FlexMove system. The FlexMove system allows the C-arm to be mounted on a ceiling gantry so it could easily be moved out of the way in case you have to convert to open procedures, or in case you have a lot of equipment in the room for anesthesiology, or in case you need better patient access. The system is designed specifically for hybrid installations, and the room that you see it being displayed in is about the size of an average hybrid OR that's being installed today.